All right, so it looks like it's 4:30, so we'll go ahead and get started. And so this is my first time doing one of these Zoom webinars, so forgive us if there are any technical difficulties. But my name is Chris Gayton. I'm one of the hand surgeons here at OrthoSC. And so the title of my presentation today is Why Does My Hand Hurt? And arthritis is probably one of the answers. So a little bit about me. I'm from Warner Robins, Georgia, and so this is the home of Betty Cantrell, Miss America a few years ago. We were Little League World Series champions, and then there's a big Air Force base there. So Warner Robins is about 2 hours south of Atlanta. And then I went to college at the University of Georgia and then medical school at the Medical College of Georgia. And then I did my orthopedic residency at Wright State University in Dayton, Ohio. And then I went to Pittsburgh, Pennsylvania for my hand fellowship. And so there seems to be a big Pittsburgh pipeline to Myrtle Beach. And so that was one of the ways I made a connection with Dr. Tubis, who also trained and did his orthopedics in Pittsburgh. So again, my hand fellowship was in Pittsburgh at Allegheny General Hospital. And so I am board certified in orthopedics and hand surgery. And my practice is focused on the upper extremity from the shoulder to the fingertips. I also take orthopedic call at Conway Medical Center, so I'm also doing other fractures, hip fractures, and any orthopedic injuries that come into the hospital while I'm on call. So we'll go and get started with the main part of the presentation now. So why does my hand hurt? There are obviously lots of reasons or lots of things that can go wrong with the hand or that can cause problems. The thing that we're going to be focused on today is mostly arthritis. Some other things that we won't focus on quite as much, but I will try to touch on briefly, are tendonitis, trigger finger, and carpal tunnel syndrome. Cubital tunnel syndrome is another similar to carpal tunnel where other fingers go numb. And so this graphic here shows a little bit about arthritis and how the bone and the joint wear out. And then over time, you get a loss of cartilage. And so then it's bone on bone, and it's almost like gravel as the two rough surfaces rub against each other. So trigger finger, this is a tendonitis, and so if you have any clicking of your fingers or the finger gets stuck down, similar to this picture, kind of like this, where you have to pop it open in first thing in the morning, is very common, and that can cause pain in the palm of your hand. And so that's another common condition that we see. And then carpal tunnel syndrome is different than arthritis. This is where the nerve is pinched in the wrist as it goes through a tight tunnel of the wrist bones. And then there's a tight ligament over the top of the nerve, and that causes compression. And so that usually gives you numbness in the thumb and then the first three fingers. And so that can wake you up at night with pain, cramping. It can be worse while driving as well. So carpal tunnel versus arthritis. So there are several different types of arthritis, and so that can involve the joints of the fingers for arthritis, and then rheumatoid arthritis can be more localized just to one or two joints, and that's an inflammatory arthritis that typically is well managed with medications. And then again, the carpal tunnel syndrome is more the nerve problem at the wrist where there's compression of the nerve. So hand arthritis. So arthritis is basically a wear and tear of the joints. It can be a deterioration of the joints. You can see in this picture how the cartilage is kind of worn away here on these bare spots. The white down here is more normal cartilage. And then over time, you get to the cartilage thins, and then you start having more narrowing of the joint space, as well as the some bone spurs that develop and deterioration of the joint. So osteoarthritis is very common, and then there are several different other types of arthritis. Inflammatory arthritis, as I mentioned, and this picture on the bottom is more inflammatory arthritis. This is what is some people refer to as a crippling arthritis, and that the fingers drift off to the side towards the small finger. There's also post-traumatic arthritis. If you had a broken bone at some point, or if you had an injury to a finger, then you can develop arthritis. Arthritis does typically lead to some of these swollen and crooked joints in the fingers. And some of the symptoms that are typical of arthritis are there's a dull, achy pain, there's clicking and grinding, there's swelling, stiffness in the morning is very characteristic of arthritis. There can also be difficulty with range of motion, pain, weakness, all of those things. So we do have our first question from Jody. Is there any way to add cartilage to the joint area? And so that's a good question. That's what a lot of people ask. Can you go in and just clean up the arthritis? And for the most part, that doesn't work very well because you can't really put back in a new cartilage. There are injections that we do sometimes, that steroid injections that can help decrease the pain in the joint, but there's no cartilage replacement at this time. Some people have tried injecting like a Synvisc type thing, but that's typically not approved for the hand. And then PRP is another thing that's starting to be investigated for arthritis a little bit more, but it's still more common in the shoulder and the knee. So arthritis is typically like a gradual onset, and it can also progress or get worse after heavy activities. When you've been out working in the backyard, in your garden, or doing a lot of landscaping work, I see that fairly commonly. The other thing that we see is a new pain after a fall or an injury, that the arthritis is very bad, particularly in a thumb or something like that, and you never really had any pain with it until you had this new fall. And so that's very common to get a flare-up with arthritis. So basically, any bone or joint in the hand can develop arthritis. And there are 19 bones in the hand, and then another 8 in the wrist, and then the 2 in the forearm. So there are a lot of different joints between all those different bones where you get your arthritis presents, that can lead to, or can help us know what type of arthritis that you may have. So it looks like we had another question. Okay, another Jody again. So treatment for arthritis in general in the hand, hot or cold, so heat and ice can both help. Typically, I'll tell my patients heat in the mornings, so a hot shower, soaking your hands in warm water, that can help to loosen them up and get them moving with some of the morning stiffness. Also, ice after you've finished playing golf or before you go to bed, you can try to ice down your hands and see how that works. And then basically, it's individualized, so whatever helps make it feel better is useful. Tylenol and Motrin are good medicines for arthritis, and so you always want to be a little bit cautious that you don't overdo it. And so, particularly with Tylenol, can cause some liver issues, as well as Motrin can sometimes cause stomach irritation and reflux, and then also some kidney problems or blood pressure issues depending on any other medicines that you may be on. So one of the best things that's recommended for arthritis is topical medicines. And so this Voltaren gel is a new medication that has just been approved for over-the-counter use. And so it's been a prescription up until recently. And looking for this presentation, it looks like you can even order it online from one of the pharmacies or from Amazon. So there are multiple different types of creams and Aspercream, things like that that are advertised for arthritis that some people have good success with. Other things, gloves and braces can be helpful. And so gloves help keep your hand warm, especially in the winter when sometimes arthritis can be a little bit worse. And then braces just help you to rest your hand or help give you some support and kind of remind you not to overdo it if you're having problems with arthritis. Another thing that's becoming more recognized as far as overall health and also with arthritis or joint pain is your diet. That's very important. And we're recognizing more and more the dangers of diabetes and too much sugar and processed foods in our diet. And so trying to limit those things, eating a more healthy Mediterranean type diet of fruits and vegetables and healthy proteins, fish can help. Also, vitamin D is becoming more recognized as being important for many things, for your bone strength, for osteoporosis, but also just for treating arthritis as well. And so getting outside in the sunshine can definitely help with your arthritis. It can help with your overall mood and everything as well. So definitely try to get some sunshine as much as you can. Looks like we have another question from Teresa, and it says, I have a pinched nerve that's causing pain in my ring finger in my ring finger and my baby finger. And so that is typical of cubital tunnel syndrome. So that's similar to carpal tunnel, but that's another nerve problem. Typically the problem is at your elbow, where there may be a pinched nerve there, especially if you keep your elbow bent for a long period of time while you're talking on the phone or reading. Sometimes it can wake you up at night while you're sleeping too. So exercises, keeping your hand moving, trying to avoid stiffness. So these are called the 6-pack exercises. And so they're basically trying to get all your joints moving, trying to regain or retain as much motion as possible. So anytime you have stiffness, that can definitely cause the pain with arthritis to flare up more. And so that this has been shown with therapy or with exercises that you can do that can help. And basically, if you're capable of getting on this Zoom call, you can probably find exercises online on YouTube and things like that that you can do, and that can be really helpful to without actually having to go see a therapist. Okay, so next we'll move on to the some of the different types of arthritis. And so the so basal thumb arthritis is definitely one of the more common things that I see. And so this is arthritis here at the base of your thumb. And so that can cause a lot of problems with opening bottles and jars, weakness with pinching and twisting. And and so this is definitely more common in women. We start seeing it in the 40s and it progresses on. Pretty much everybody gets some arthritis at the base of their thumb at some point, but most people don't end up needing surgery for it. So it's something that may kind of flare off and on, um, and but it is definitely treatable, and sometimes the pain can go away even if the x-ray or the joint looks fairly bad. So this is a picture of the x-ray with the arthritis, and you can see how the joint is worn, or the cartilage is worn away, and so you're bone on bone there at the thumb. You're starting to get these big bone spurs, and then the thumb is kind of shifting a little bit out to the side, and you may notice that you have a bump there on the side of your thumb a little bit more. So again, thumb exercises have been shown to help with some of the pain with this. The braces, like we were talking about, and then also steroid injections, where we put a cortisone injection basically right in the spot, and that can last for 3 to 6 months and definitely help with the pain. So another thing that can go along with thumb arthritis is de Quervain's tendonitis. So this is a wrist tendonitis, and you can see in the picture where this is inflamed, and this is just below the thumb joint here. And so new moms get this a lot from picking up their new babies, and this can cause pain while you're gripping or lifting. And sometimes you can get arthritis as well as the tendonitis. So that's very common, is to have multiple different things that are going on that can be contributing to your pain. So these are the thumb braces that I was talking about. There's some smaller wraps and hand-based braces that allow you to still be able to have some motion with your wrist or with your thumb. And then there are also the bigger, stiffer ones that will keep you from really moving your thumb at all. And so these definitely limit your activity more, but sometimes that's what you need. So I typically recommend getting one or probably 2 different braces, so that way you can kind of rotate between depending on what you're doing and how it's bothering you. So surgery for the thumb arthritis is very common. It's something that we do frequently, and we have good success with it. So basically, again, in this x-ray, you can see how it's bone on bone. They're the big bone spurs. And so for the surgery, we go in and we take out the bone, the trapezium, so one of the smaller bones of the wrist. And so this is called a thumb arthroplasty. So it's kind of like a total knee or total hip replacement in my world. And so then when we take the bone out, we use sutures to form a little sling or a hammock between the two tendons. And that keeps the thumb in a good position, allows you to still move the thumb and keeps it from collapsing down. And that allows you to maintain the space and not be bone on bone anymore. So moving on to finger arthritis, if you have bumps on your fingers that are developing, these are common signs of arthritis. If the fingers are starting to get crooked, you may have noticed that your mom or your parents had fingers like this, and maybe yours are starting to look more like those. That's definitely very common as we age and you start getting these crooked fingers. You can also get cysts on the joints that can sometimes be a source of problems. So this is a picture of the cyst over the DIP joint. So this is the joint right at the tip of the finger. And these cysts actually fill up with joint fluid. So you can kind of see how it's like a water balloon where the fluid gets out and forms the cyst, but then it can't get back into the joint. Now the problem with these, if you drain them, they can actually get infected. And so that's why if it starts to drain or leaks or anything like that, that's a reason to come and see me. And usually at that point, I recommend taking them off to try to prevent an infection. There's usually a bone spur that's contributing to this. And so a lot of times dermatologists will try to remove the cyst, but they don't do anything with the bone spur. And so typically the cyst will come back again if you don't take off some of the arthritis. So for these joints, if you have a cyst that keeps coming back or you're having severe pain that's interfering with activity, then we typically for this arthritis, we'll recommend fusing the joint. And so this works very well. It's very reliable. And so people do well. You can still pinch with your finger, and typically you can still make a good fist. Your fist just will kind of come down like this instead of quite as much like that, but people still have good strength, and it definitely can help with their pain. So moving on down the finger, the next two joints are the PIP joint and then the MCP joints. And for these joints, it helps to have more motion. So typically we will try to do a replacement again. And so you can see these there are metal and plastic replacements that we will use. And so these are silicone in the plastic, and then it's a pyrocarbon metal on metal replacement, or similar to metal, that allows you to replace the arthritis. In this middle finger, the patient actually had to have a fusion, and so, but that's not typical. Typically, we want to try to maintain motion as much as possible. But depending on which finger it is, then sometimes a fusion can be a good option, depending on why you have the arthritis to begin with. So moving on to the wrist, the arthritis here can be an issue as well. And so this can be an issue with an old injury where you have a break of one of the bones or an injury to the ligaments between two of the smaller bones in the wrist. And then over time, this space narrows and starts to be more bone on bone. And then you can get swelling down in the wrist area that sometimes people think is a cyst, but it may just be swelling from the joint space. So again, a couple more pictures. You can see the widening between the bones of the wrist, and then it's starting to be bone on bone here on the thumb side of the wrist. The other side of the wrist, there's still good space between the lunate bone and the radius. And so in this case, what we can do is we actually take out these 3 bones of the first row of bones of the wrist. And that there's good cartilage still on this bone, the capitate. And so the capitate will then settle into the place where there's good cartilage and allow you to retain motion. And you also don't have to put plates and screws or anything like that in to try to get the bones to heal. In other situations, depending on how the arthritis is developed, sometimes we'll have to put in a little round plate or screws to fuse the bones together. And then there are wrist joint replacements that are coming out too that are not as common as the thumb and definitely not as common as a hip or knee, but there have been good early results with those. And so depending on what's going on, you may be a candidate for that. So basically that's the end of my presentation at this point. And so it looks like we still have plenty of time for questions if you have any. And we do have one other question that was submitted prior to the presentation. And so I'll go ahead and address that one first. And this question is saying that I had an overuse problem with my hand. I did a lot of work with the trowel, lifting up and away with my wrist. The pain is on the outside of my hand, and I've also had problems with trigger fingers of the last 3 fingers of my hand. So treatments for this, we talked about injections a little bit. That's one of the best treatments for the trigger fingers, and about 50% of the time that will take care of the problem for good. So the other thing that may be going on is de Quervain's tendonitis that we talked about a little bit as well. So another question was how long between injections? And so usually recommend waiting about 3 months between injections. And because the injections can cause problems, especially if you have diabetes, and so we don't want to do too many of those. They can also cause some problems with the skin and changes there as well. Jody says that she has some thumb arthritis, and so basically that she had an injection a few months ago, and it's been a huge improvement as far as her pain. She is asking how many injections would you recommend before surgery? And so it depends. It all depends on your life and what you have going on and how you react to the steroid injections. So typically for arthritis, we'll do at least 1 and then maybe 2, depending on how well they work and how long they work. And so if you get good relief for 6 months or more for injections, then we'll continue doing those. For arthritis, there's usually not too big of a danger of continuing to do the injections because the joint is already damaged. And so we will continue to do that. For some of the tendon problems, it can cause problems with wear of the tendon. And so too many injections, we do think there are a risk of infection too. So at some point, sometimes it's better to go ahead and proceed with surgery. Teresa is asking if we had a cold laser machine, and I don't believe we do. I'm not familiar with the lasers quite as much. I know some of the therapists and some of the chiropractors have used those, and some patients have said they've had success with those. So And basically, in my opinion, if there's something that works well for you, then I recommend that you continue doing it. Um, but if it stops working or is causing problems, then I wouldn't recommend continuing to spend money on things like that. And so we had another question about the supplements and some of the copper products. The copper bracelets and things like that haven't really been shown to make much of a difference with arthritis. The Some of the supplements, the turmeric and other things, can be helpful for arthritis, for helping with some of the inflammation. And so, again, if it works well for you, then I think keep using it until it stops working, and then you may want to switch and try to do something else. So, um, so I see patients in Conway, and typically it's pretty easy to get in to see me, usually within a few days or a week or so. And so if you would like an appointment or have any questions or anything, you can leave your name and phone number in um, the question and answer box, and the and then we'd be happy to contact you later. We have a couple of other questions, and so Teresa asked about the C8 nerve in her neck causing pain in her hand, and yes, so they're definitely, as we mentioned, there are other nerve issues that can cause problems. You can have what's called a double crush, where you have a pinched nerve in your hand and then also in your neck, and that can cause sensitivity in both places. So it's very common if you come in to see me that we may recommend getting x-rays of your neck, and that may be contributing to some pain in your shoulder or down your arm, in addition to any neck pain that you may have. The Joanne has a question about if the bone at the base of the thumb needs to be removed, do you go to therapy afterwards? And how long do you before you return to regular usage? So I typically do surveys on my patients after they've had surgery to kind of follow up and to answer this question. And usually for arthritis surgery, it takes about 3 months before you're kind of back to baseline, to get your strength back and to get back to more normal activities. But most people get more pain and function than they had before surgery. It definitely doesn't make you 20 again, unfortunately, but it usually gives you more strength and takes away the pain. It's good for pain relief. So for the thumb surgery, there are usually I do use therapy, and we use a brace for about 6 weeks after surgery. That allows you to rest and gives it time for everything to heal. And then you start getting back to using it more, start working on getting your strength back. So definitely usually by 3 months, people are glad they did it. And a lot of times the arthritis pain goes away pretty quickly after surgery. And so then you have the surgery pain that you have to get rid of or to get your strength back. And so, but it's definitely a different type of pain than you had prior to surgery. So, and then Teresa had another question about the talking about the neck and a possible fusion that may help the pain go away in the shoulder or the hand. So yes, that's typically what they do. If you have a pinched nerve in your neck, they will decompress or free up the nerves in the neck, and then they have to stabilize the bones in the neck to prevent more arthritis or to prevent any problems from too much motion between the bones. Another question we asked about is, does OrthoSC use a waterproof cast? And yes, we do. We have those available. Insurance typically doesn't cover those, but they can definitely be a good option for the summer when it's hot. You can take a shower with those. You can go swimming with the waterproof cast. And so that can still allow you to have some fun during the summer, even though you may have an injury that can cause that unfortunately you have a broken bone or have to be in a cast for a few weeks. And so if we have any other questions, definitely let us know. And we'd be happy to talk to you at the office. And again, if you want to make an appointment, you can leave your name and phone number in the chat or question box, and we'll be happy to get back in touch with you. So another question, is there a brace to keep your elbow straight to relieve the pain in your hand? For cubital tunnel syndrome, there is a brace. We don't typically keep those in the office, but you can find them on Amazon. So Amazon is a great resource that I use a lot to be able to find different things for patients. And so it's called a cubital tunnel splint or a night splint. Sometimes I actually recommend patients, if you're at night while you're sleeping, that you can put your arm inside of a pillowcase, and the pillow will keep you from bending your arm too much. And so that can be helpful. Some people do well with wrapping a towel around your elbow or using an elbow pad, and then you can turn that to the front of your elbow, and that pad will keep you from bending your elbow too much as well. And so those things, braces for carpal tunnel, it can be helpful as well. And so if you sleep in the brace at nighttime or use that while you're working on the computer or while driving, then that can help with the numbness and tingling and everything as well. So Lisa, just let me know, we do have some cubital tunnel braces at the offices too. So those are, so you could call us and we could try to talk with you about that as well. So. So it looks like we may be kind of wrapping up now with all the questions and everything. And so thank you for attending. Thank you to Lisa for helping set this up. And if you have any other questions or other topics that you would like us to address in these webinars, we'd be happy to try to do that. Another thing that I've started trying to do is putting some videos and things like that on a Facebook page. And so we'll do those on the OrthoSC Facebook page as well. And so if you have any other questions, we can try to address those in the future as well. So at this point, I think we will wrap up. We do have one other question. Is there anything you can do to relieve the pain when writing? And so the pain with writing can be somewhat difficult. It depends on what is causing it. And so with writing, you can try a wrist brace or a wrist wrap, and that can be helpful. And then sometimes it can be carpal tunnel syndrome that could be contributing. And so you could try an injection before surgery, and that can be helpful as well. So it all kind of depends on what's causing the pain while writing. Sometimes people get cramping just from writing, and so it's sometimes it can be difficult to know. But we'd be happy to try to check you or figure out what may be causing the pain. So.
Dr. Gayton, that looks like that's all the questions. You did an incredible presentation. Thank you so much.
Thank you, Lisa.